Thank you so much for joining us today for our Safe Beauty panel. We're going to be exploring a lot of misconceptions. There are so many, and many have come up just this week. We're not going to explore all of them. There's so much to unpack here, but a little bit. So we're going to be exploring, are your cosmetics safe? And also, are there like legitimate challenges with respect to regulations? If you guys have questions as well as we're going, there's a chat going that I'm looking at that I can ask our panelists. If it fits in the conversation, that I'll ask it during the conversation. Otherwise, I'll ask it towards the end. But I'll get off my platform now and let all of my fabulous panelists here today. I'm with a number of chemists and toxicologists to explore the topic. And first, Anke, would you like to introduce yourself?
Sure. Thanks, Jen. Well, thanks for having me, first of all. I'm very happy to be part of this group. And my name is Anke Ginzburg. I have a background in pharmaceutical analytical chemistry. I've been working in the cosmetics industry since 2005 and recently specializing in the development of active ingredients. And I have worked in claim substantiation, product development, and also some quality assurance. And as I said, active ingredients development. And I work mainly in the European Union, but I have some experience from the US. So I hope I can contribute with some valuable insights from both sides.
Michelle, would you like to go next?
Hi, I'm Michelle Wong of Lab Muff and Beauty Science. So I have a PhD in medicinal and supramolecular chemistry, but most of my work these days is in science communication. So as well as I have a really strong teaching background, I guess. I've been teaching forever. And yeah, I'm better known as Lab Muff and Beauty Science. I talk about the science behind beauty products on YouTube, on my Instagram, on my blog. And yeah, I've been doing it. This is actually my 9th year doing it. At the end of the year, it's going to be my 10th anniversary. So 10 years since I started.
Feel like you were the OG on Instagram. Stephen, would you like to go next?
Yes, hello everybody. My name is Stephen Kirk. I'm a regulatory toxicologist by background, and I've spent the last 25 years working in cosmetic product safety, the full spectrum of the whole life cycle management, from raw material selection, helping formulators put together their formulations, safety assessment of cosmetic products. So I've seen the safety assessment process in Europe, the original directive, and now then what we still call the new regulation, and then through on to cosmetic vigilance, post-market surveillance, which I think is very, very important aspect of cosmetic safety, which isn't really considered by a number of companies, unfortunately, how important that information is. And yes, I'm very pleased to be part of this panel and hopefully can contribute some useful information.
And then last but not least, Cassandra. You're muted.
Sorry. Hi, I'm Cassandra Celestin. I am a cosmetic chemist. I've been in this industry for over 15 years. I'm also a cosmetologist and makeup artist and a trichologist. I formulate hair, skincare products, and I have my own business, a consulting company where I consult in cosmetic formulations for hair and skincare, a lot more hair care, a lot more, I would say, one-on-one basis for people who are having issues with their hair as well when it comes to trichology as well. And I'm glad to be here on this panel, and I hope I can contribute some really good information to this panel.
So my first question will be directed to the formulators in the room, but everyone is welcome to answer this. Obviously, you all have insights here. So the first question is, just because I hear this a lot, that cosmetics aren't regulated. So are cosmetics regulated? How? And then from your perspectives in both the Anke is in the EU and Cassandra's in the USA, are products safe? What do you guys think? And Cassandra, would you like to kick this off? You're muted again.
So sorry. The FDA has set laws for regulation. However, the FDA does not go into a company and actually say, "Hey, this is supposed to be like this." They have guidelines and laws that they set that companies are required to uphold and follow. So they are regulated. However, the FDA does not require approval for those cosmetics to go out on the market.
Yeah, I find this is a point of confusion in the USA market, just to like butt in. And I would be interested in your feedback here, because then people are like, well, the FDA doesn't require all of this, so companies are free to do whatever they want, which kind of ignores the litigious, very litigious nature of the USA public that does a really good job keeping companies in check. Based off of what I've said, are the vast majority, from your perspective as a cosmetic chemist, in working in the USA, are products on the market safe? Is this something that consumers really need to worry about? And if there is safety challenges, where should they worry about it?
I do believe they are safe. Generally, they are, because most manufacturers do not want to be liable for a product recall or a lawsuit. So yes, they are generally safe. The concerns I would say, and personally myself, would come with the home-based products. Because we're not sure if they're following, the GMP, the good manufacturing practices. So I would be a little concerned by purchasing products offline where people are formulating products at home.
Anke, what do you think from the EU perspective?
Well, the question was, are cosmetics products safe?
And also regulated.
And regulated, that's right. So they are regulated, especially in Europe, because the cosmetics regulation is very elaborate and also quite explicit about spelling out what is allowed and what is not allowed in cosmetics products. In the formulations in respect to ingredients that can and cannot be used to formulate a cosmetics product, but then also regarding the tests that need to be carried out in order to assure that a product is actually safe. So the aspect that I really would like to throw into this discussion, and I know I'm doing this early, is the fact that cosmetic safety isn't only limited to the formulation. I think this is something that a lot of consumers perceive, and also where a lot of the worries come from when it comes to cosmetic safety in regards to ingredients. Especially when we compare the US to the EU, because we have in the EU this long list of ingredients that are explicitly not allowed to be used in cosmetic formulations, whereas the US doesn't spell these out as detailed. But what I would like to highlight is that there's actually another aspect to cosmetic safety, and that is the way that a cosmetic product is used. So are cosmetic products safe when they're on the shelf, on the market? Most likely, if companies are following the regulations. But then a big part in cosmetic product safety is also how consumers are using them. And this is something that we sometimes forget, that if cosmetics products are not used the intended way they are designed to be used, then any product can potentially become unsafe. If you use a lip product in your eye for makeup and it's not appropriately preserved or designed for the most sensitive area in the waterline of the eye, for example, you are using a potentially unsafe product in that area. So yes, cosmetic products are regulated. Are all cosmetic products safe? Depends very much on the way how the product is designed, but also how it is used. So it's very much up to the consumer also to make sure that the products they're using are actually safe for them.
Okay, I want to open this question up if you guys are okay with this, Michelle and Stephen. Would you guys mind chiming in on this question too, Stephen, from the regulatory toxicologist perspective first, maybe?
Yeah, certainly. The Anke's raised a very, very good point about the way that consumers use products. Certainly in the EU regulations says that a cosmetic product must be safe in terms of the way the safety assessment is conducted. For a cosmetic, you can't have any risk-benefit analysis. That's not a concept that exists. So we can assess a product in terms of ingredient safety and then the finished product safety in however testing you conduct. But it's not until consumers start using it that you then identify potential misuses, and that's why I'm very interested in cosmetic vigilance, because that shows us how cosmetic products are or can be misused by consumers. I think the fundamental premise of the EU regulation is very supportable in terms of how we have to do the safety assessment from start to finish. So yes, cosmetic products in Europe and beyond are safe. It's the way consumers use them that changes or can change the safety profile. The question about the US, I think that's a really interesting comment or question, and Cassandra's comments about the home cooked cosmetics being of concern. I would very much support that that comment. I would say that despite some of the comments that come from people of all groups in the US about US products not being regulated compared to the European situation, a lot of the bigger companies or the large companies sell product both in Europe and in the US, and I would argue that they apply the same standards of safety to their products that are sold in the US or indeed in Canada. So consumers can use those products in the knowledge that there has been a safety assessment conducted with them. Less confident about the smaller brands that you might find in markets and farmers markets, for example.
Michelle, from the Australian perspective, what are your thoughts?
Honestly, from an Australian perspective, our regulations tend to mostly follow people from overseas or other countries from overseas. But one thing I've noticed a lot in the, I guess, consumer space is that people, I think you've all definitely noticed this, people assume that the EU regulates products correctly, and the US is just, the wild, wild west. When in fact, a lot of the things are really just not true. So there's always myths like parabens are banned in the EU, but they're allowed in the US. When parabens are not banned in the EU, there are some that are limited, but the most common parabens are, still methyl ethyl paraben, still very commonly used. Other things are things like the US has unsafe sunscreen regulations, when if you look at the comparisons, the percentages used in both regions in popular products are pretty much the same. The actual limits are the same for most filters, the ones that are allowed in the US anyway. So I think there is this sort of, at a general level anyway, I think if you're a big skincare nerd, then you know this very well. But I think there are a lot of brands that are capitalizing on this perception that the EU regulates things in a very different way, when in fact, that's just not really the case. Most products that are allowed in the US are also allowed in the EU and vice versa.
Such as a brand, there's a Okay, I'll just call them out because Beauty Counter, as part of their marketing, is like, we follow the EU standards, except we ban, I think they go and say they ban like 1,500 instead of 1,200, something, or 1,300, however many is banned in the EU, something ridiculous. We banned this many ingredients and thus we're safe because we're following the EU standards. Like, really? uh, okay, so we'll come back to misconceptions. Michelle has many, but my next question here is for Stephen. So, how is risk assessed, and then for products, how is safety ensured?
That's a good question, and that goes to the fundamental premise of the EU regulation and the way that we operate in the Europe. And what I would say is, up to now, I've always been working according to the EU regulation. So for people who are in the UK, essentially the UK cosmetic legislation is a mirror of the European legislation. So when I refer to the EU regulation, it also encompasses the cosmetic legislation in the UK as it stands today. So the whole assurance of safety starts at the very beginning about the with the selection of the ingredients, ensuring that that you know, so as a toxicologist, that you know what's going on, what's put into your ingredient. One of the complexities is that cosmetics are very often not made with single substances. They're very often made with blends of substances. This, in my mind, is one of the pitfalls of the ingredient labeling situation that we have to use in Europe, in as much that the ingredient label doesn't show where the individual substances come from. It's just a sum of the substances that may be present in the finished product. So it's incumbent on the toxicologist or the safety assessor reviewing the product to know exactly what's being put into the finished product as it's being manufactured. So the risk is assessed based on the hazard of the individual substances that we go in. Anke's already alluded to the fact that in Europe we have certain lists of chemicals. We have a list of chemicals that are essentially banned. Now that's a bit of can be a bit of a misnomer, because for certain substances there may be present as impurities. So if a substance is banned, you can have it present as an impurity, but the safety assessor actually has to argue that the level in your finished product doesn't impact on consumer safety. We then have a list of chemicals. Strangely, they're banned, but you can use them under certain circumstances. We then have a list of colorants that we can use. So those are the products that you would put into, well, the substances you would put into change, say make a shower gel pink, or a color cosmetic, the color that it is. We then have a list of approved preservatives, which is diminishing day by day because of various things, and then a list of approved UV filters. So those substances have generally the safety has been reviewed by a scientific committee at some stage along their lifespan. So part of the role of the safety assessor is to ensure that any chemicals that are on those lists are being used appropriately. So we can look at the hazard from that respect. But at the end of the day, we have to carry out a risk assessment, and that's based on the exposure. And I noticed that Michelle was going to be talking about a little bit about risk and hazard, but risk and hazard also come into the safety assessment in terms of how we look at chemicals, look at their toxicity profile, and then under the circumstances that they're being used, whether or not they're safe to use. So an extreme example I often use is that we drink water every day, so I've got a glass of water here. So you would think that water is quite innocuous, but in fact, water is quite toxic, particularly if you attach lead weights to your legs and then you get dragged underwater. So you can't, there are the whole thing about risk assessment is assessing the hazard and how people are exposed to it. So within the EU regulation, we have to characterize the hazard of each of the substances in a finished product, and then look at how the consumer is likely to be exposed to them, and do certain, if appropriate, toxicological calculations. But if you can't do those calculations, we have to actually prepare an argument as to why we feel the product is safe. And it's the safety assessor does actually have quite a lot of power, if that's the right word to use. Not every safety assessment is a rubber stamp. So we do actually have the authority to not allow a finished product to be placed on the market unless we are satisfied of the safety profile of the ingredients and also how it's going to be used. So going back to Anke's point about consumers using product in strange ways. So yes, if you have a you can assess a product for use on the, say, on dry skin on the feet. You wouldn't expect that product to be used on the face, but some consumers might take it upon themselves to use that product in areas where they shouldn't do, and that's part of the that's part of the safety assessor's job, to try and assess the safety of the finished product according to consumer usage. Another important point to make in the safety assessment, we don't only look at the ingredients, we also look at the way the product is going to be used. And if we feel it's necessary to put certain warning statements in the product's artwork, then again we have the jurisdiction to do that. And there are some warnings that can be used that aren't necessarily governing the product, but the way the product is used. So oils, for example, that you might use in the bath or the shower, they're probably safe, but if people use those oils in the shower, they're likely to cause the shower tray or the bath to become quite slippy, so consumers can fall over. So that's not a fundamental issue for the product itself per se, but it's how the consumer uses the product. So there is certainly in Europe and countries that have adopted the European regulation for their own, there is quite a lot of work goes into the safety assessment of the finished product, and then of course looking at the Cosmetic Vigilance once it's launched to highlight any peculiarities that might be caused either the way people use the product or in the ingredients that are being used in terms of skin reactions and things like that. So it is very, I can assure people that it is a very comprehensive review from start to finish.
Reminder to anyone who is watching, if you have questions as we go, stick them in the chat and then I'll be able to ask. If it fits in during the conversation, then I'll ask it then. Otherwise, I'll be asking the questions towards the end. My next question is to Michelle. So what are your experience online? You have the most experience out of all of us, for sure, on in the consumer online space especially. So what are some of the misconceptions, most common misconceptions, should I say, that you've seen online? And maybe also with some of the marketing that you've seen online as well.
There is a very long list, Jen. So it's going to be a bit challenging. But as Stephen mentioned, I think the idea of hazards versus risks are quite confusing for consumers. And not just that, but also just I think it's very easy to see a lot of issues around safety as very black and white. So this substance is okay, this substance is not okay, without any sort of, I guess, firstly, there's the hazard versus risk, the whole exposure element of safety. As Stephen said, if you have water, if you put it down the wrong way, if you put it in your lungs, it's very different from pouring it on your hand or like drinking it. But on top of that, apart from exposure, which I think we've all talked about quite a lot on our platforms, those of us who are public facing, there's also just the idea of what sorts of risks there are. And there is something on benzene that has recently come up. And one of the statements in the report that a lot of people have freaked out about is benzene is a known human carcinogen. And I think that is also one of those things where people just don't really see, I guess, the idea of, so I think the way that people have seen this, like there is no safe level of benzene is a known human carcinogen, is that if you're exposed to any benzene at all, you are going to get cancer as a certainty. When in reality, it's very different. It depends on route of exposure, dose, how much you end up with. At the end, not everyone who has been exposed to benzene has gotten cancer. I think those of us who know older chemists will know that a lot of people used to basically wash their hands with benzene and they haven't gotten cancer. But yeah, I think there's a lot of phrases, I think, that are quite well defined when it comes to scientists, but then when it filters out to the public, it becomes misinterpreted because there's a lot of nuance around this sort of language. So I think some of it does come down to certain things, certain reports, certain phrases used that are well understood by a particular audience. These go out into the public for whatever reason, and then in that context, it's very different. I think from a science communication perspective, we've seen this a lot with the word significant. So if you see significant in a study, it doesn't mean it's a big deal. It means it is statistically significant. It's not likely to be up to chance. And I think there are a lot of other words that are used in toxicology of cosmetic products that have this sort of similar misconception, like the way that a normal person would read this word is very different from the way it's meant to be interpreted. And yeah, I think that's where a lot of the myths come from. So I guess like in terms of basic myths, we've already sort of covered the EU versus US, the fact that the EU supposedly regulates cosmetics very differently from the US, and US products are a lot more unsafe. There's also, if your product contains an ingredient that has been linked to any sort of harm, then it is going to cause that harm. And related to that is, if your product contains an ingredient that has been linked to a harm, it's best to just get rid of that ingredient. Shouldn't we be more cautious? Shouldn't we take the cautious route and just get rid of this ingredient? I think, Jen, you and I have both definitely talked about this a lot in terms of preservatives and the hidden risks of getting rid of something that seems to be harmful. What else is there in terms of safety? I think what Anke and Stephen brought up in terms of how one uses a product has been very underrated in terms of safety. So I think on the one hand, we have lots of people being very concerned about whether or not products are safe. And then on the other hand, a lot of the same people are putting on, for example, a peel product, a product that has 30% alpha hydroxy acid, and then putting on their face and leaving it on for longer than the recommended time, or perhaps using it in a way that wasn't intended. For example, there is a famous one of a guy on TikTok who put the peel on his face and then used a derma roller and rolled it all over his face. So yeah, I think a lot of this stuff, there's a lot of nuance that is clear to people who are experts in the space, or people who have just been exposed to a lot of the sorts of terminology that's used in toxicology. And then, it gets misinterpreted, and then it turns very black and white by the time it reaches either consumers, and brands take advantage of this in a lot of their marketing if they see that there's some sort of, I guess, financial incentive for them.
I was glad that you raised the point about significant, Michelle, because that's in my early days of working as a regulatory toxicologist, we were always taught to look at the biology and use your statistics to support the biology rather than just purely stargazing, because there are things that can be statistically significant that aren't actually of any importance. Another comment to complement what you've just said is that a lot of the adverse comments that we see in social media, in the press, or on television, whatever, they tend to focus on the hazard, and they don't. We need to give them the basic lesson in what Paracelsus said, I think, about everything can be toxic. It's the dose that distinguishes something from being a poison, from being innocuous. And people tend to forget that, as you said, the dose is important, the dose is critical in the whole risk assessment process.
And I think this is something that is very underutilized in consumer informing apps. Most consumer informing apps that are supposed to give information on safety actually purely give information on hazard. They don't give information on concentration or associated risk. So when we're looking at some of these apps, and Stephen and I have had long conversations about this, they are very alarming to many consumers because what they're using as visual communication tools are often green, amber, red signaling, indicating that something in the red area is supposed to be hazardous. But something that has a hazard associated with it as a pure substance does not necessarily pose a risk to a consumer when it's part of a cosmetic product, especially when that product is used in the way it is supposed to be intended to be used. So an example would be a fictional ingredient that has a hazard that in an app is rated as red, but when used, let's say, in a foot cream at a certain percentage is perfectly safe to be used. And the consumer can still make it a hazard by using it in the wrong way. So there are several elements that I'm really, really missing in this overall communication, especially when it comes to the app informations. There's more and more, or I've seen two examples at least, where there's actually risk and concentration levels being factored into the consumer facing information. And a piece that is also missing from the conversation is that the EU regulation actually also distinguishes between different levels of concentrations for certain types of products. And also if the product, and this is something that Stephen mentioned earlier, if it's, for example, left on the body as a lotion, for example, or if it is rinsed off again from the body as part of being in a shower. So the regulation makes clear distinctions between not only the hazard, but also the risk based on the concentration, which is completely missing from most apps.
Now, based off of a lot of the app information, a common statement is that these ingredients are endocrine disrupting. And I had this question come up from one of my Patreon supporters, who I believe she's a toxicologist, but she just, this is a claim that bothers her. AC, thank you for supporting me on Patreon. But her question was around endocrine disruptors that are commonly talked about in the media. Is this like a significant concern? Should we be like really, really scared, I guess, as is often communicated about endocrine disruptors in our cosmetic products? Stephen, maybe this question would be best asked to you. I'm not sure. Sorry for not telling you in advance.
Yes, it's an interesting question, and one that crops up quite regularly indeed. Within the EU is very concerned about chemicals. I would call them endocrine modulators, and some are true, some are, some can be potentially hazardous, some are potentially not hazardous, but nevertheless EU is very interested in them at the chemical level and is adopting appropriate management, exposure management criteria to deal with them. I don't know ever so much about endocrine disruptors as a chemical class or the toxicology of them. So I have to make that point right from the outset. However, there are some endocrine disruptors, so there are some chemicals that we use as cosmetic ingredients, which could be potent endocrine disruptors, but we don't think twice about using them as foods, or indeed as cosmetic ingredients. So I'm thinking about soya-based materials, where soya's got quite a reputation for having these types of effects. You just have to look at the number of ingredients that promote their usage in skin aging applications based on their hormonal activity. So on the one hand, we're calling out endocrine disruptors for being bad. Yet on the other hand, we're quite happy to use these naturally occurring substances as cosmetic ingredients. A lot of the methodology, certainly the ones based on the intact animal, some of the effects that are seen are quite specific to the particular experimental model. I'm thinking of the rodent pituitary thyroid axis, where you get tumors arising in the thyroid. That is quite a specific mechanism to rodents, to rats, for example. But if a chemical produces that, it gets tarred with the brush of being an endocrine disruptor, which it may not actually be. It may not be relevant to human experience. So it's quite a, in my mind, it's quite a controversial topic. As I see it, for a number of reasons. And as I said, I wouldn't profess to being an expert in the field, so I tend to defer to others who are more expert if the need arises.
Anke, from the pharmacist perspective, do you have anything to add, or should I move on to my next question?
I can maybe add a little 2 cents, which is that one thing we shouldn't forget, and I'm not trying to discredit science, quite the opposite, is that science evolves. So whatever information we have today is the best information we have. And it doesn't mean that by making new findings tomorrow, that perspective isn't going to change. Mm-hmm. So by asking the question, should we worry about this with the information that we have today and the knowledge that I have today? And like Stephen, I'm not an expert in this field, but from the information that I have available at the moment, I wouldn't worry too much. At the same time, we are evolving our analytical models, we are evolving our test systems, and this doesn't mean that we might not in the future find information that simply today we don't have, which is going to make our products even safer, and our decisions about which ingredients to use and which not to use even more rational. I'll give you an example. when radium was first found, it was all the craze, and everybody formulated everything, including cosmetics, with radium. At that time, radioactivity wasn't very well researched. So at the time, we simply didn't know what that meant for us. Today, we don't know everything, as we didn't know everything 100 years ago, and science is evolving. So I'm reluctant to go out and say, this is the way it is, and this is how it's always going to be. But I am not too worried for what I know today. There's always new data coming in, and I will always be looking out for that. And it could be that we in the future, once we know more, will eliminate ingredients that we're using today. But that's the nature of science, and it's the best tool we have today, and we should trust it.
Okay, so I'm going to quickly comment on some of the questions that I've gotten on Patreon, just because there's a lot of questions, and I also still have a lot of questions for you. If you guys disagree with anything that I say, then please chime in, but otherwise I'll get to my next question, which will be directed to Cassandra. So Beyond 50 Skin was asking about the Valisier study. I'm just going to say, Kind of Steven has a great perspective on his Instagram right now, so go check that out. I think Michelle's working on a post. I think we need more information, and I'm working on getting more information, so hopefully I'll have something up regarding that in a few weeks. It's going to take me a few weeks because we don't have that much information, but Kind of Steven has a great post on this. Another question was with respect to chemical, organic, I mean what you would commonly call chemical sunscreens, and pregnancy, is this safe? This is a question that it comes up a lot on my Instagram feed, and I've had several regulators and a dermatologist and toxicologist chime in on this point. Stephen, obviously, if you disagree with me, then please let me know. But the consensus is that if the sunscreens are approved, like using approved filters at approved levels, I wouldn't worry too much. There's not really that much evidence that it's going to be, actually no evidence that it's going to be harmful. Benefits outweigh the risks. So use whatever sunscreen that you like. The best sunscreen for you is the one that you actually like and will apply enough. If anyone disagrees with this statement, then please feel free to correct me. Otherwise, I'll ask my next question.
I just wanted to add, just a quick note. I think a lot of personal risk also depends on the person, like what level of risk you're willing to accept. So if using a chemical sunscreen is going to make you stressed all through your pregnancy, then maybe it is better to use a mineral filter, even if the science says otherwise. Just wanted to add that.
Agreed, completely.
Good point. Okay, so then my next question is going to first be directed at Cassandra. So are there any repercussions for non-compliance?
Yes, absolutely. Non-compliance as far as what's regulated in the US. If a person or a group of people put a complaint in with the FDA, then they will go in and investigate to see what's going on with that product and send out a warning as well. And to tell you to reevaluate or recall your product from the shelves. And we saw in 2020 how that happened very often with hand sanitizers. A lot of people were just, rushing to put out hand sanitizers, and they were using all types of alcohols that were not meant for cosmetics, meant to be used on the hands or the body, and that were harmful for the body. And that's what the FDA does. It regulates that and prohibits the use of adulterated and harmful products. And those companies get heavily fined and even shut down sometimes. So yes, there are.
Anke, from your perspective in the EU?
So I guess this is one of the big differences between the US and the EU. I mean, the US really has the FDA as the police marching in and really get active. And that is on a federal level. The EU does have the regulation on a federal level, but then the enforcement happens on the individual state level. And it does also get notified on an EU level in the safety alert tool. So the EU sends out reports every Friday, and that's open to everyone who would like to receive these reports and see which safety alerts have been put out. But then it is up to the individual member states to follow up and with the competent authorities to actually enforce either any complaints or to follow up on recalls and to enforce those. And from what I have seen so far, I think the FDA is probably better equipped and also more reactive than individual member state competent authorities in the EU. So each individual country has their competent authority where complaints can be made. Just a few examples in now not EU anymore, but in the UK, it's the trading standards or the ASA, the advertising standards. And then individual countries have their other respective organs. But that doesn't automatically mean that they will also spring in action and make reinforcements. A lot of these alerts get raised upon cross-importation across borders, when shipments are being assessed in customs and documentation is reviewed and individual spot checks are being made. But when it comes to enforcement, I would think that probably the US is in a better situation than the EU. Please feel free to disagree with me on that level, but that this is something that also sometimes gets left out of the discussion when it comes to US versus EU cosmetic safety.
I mean, this is not the first time that I've heard this from someone in the EU perspective, and I think that it's interesting for you to say that because that's obviously the opposite of what a lot of consumers in especially the USA think. So you've heard it now twice on my platform, first from Teresa Callaghan and now from Anke. I'd be interested if anyone else has comments here to add to what's said, Stephen or Michelle.
I tend to agree with completely with Anke, what she just articulated, and haven't really got anything more to apply or to add to it.
Michelle, any additional comments?
Yeah, me neither. I think maybe consumers who think that the FDA doesn't enforce things, maybe you can go to the FDA website and have a look at the letters. There are a lot of letters to look through. So yeah, I think maybe if it was a bit better known that there's this list of letters with enforcement actions, then yeah, maybe that myth might die a little bit.
Yeah, and like back to Cassandra, just based off of something that I've seen on social media, and I have commented on this, but I'd love for you to comment on this. So yeah, I've heard this from specifically beauty counter reps, where they highlight the fact that the FDA doesn't have the ability to actually remove products from the market when they send out a warning letter. Now, like when warning letters are sent out, though, these products are recalled. It would be really bad if they didn't. But anyways, what do you think about that comment?
Yeah, I think it's just people misunderstanding what's going on in the industry as far as how the FDA works with cosmetics. And here's the thing: I've been in a situation where I've worked with a company and they mislabeled their products. You know, it was actually a OTC and not a cosmetic. And the thing is that, you know, a lot of companies and brands can probably get away with it for a while, but if you start making a lot of noise in the industry and your product as far as marketing and your product is really, really big and, you know, people either they're good or they're bad. If it's good and you're making a lot of money and you're, you know, say, for example, saying you have OTC products but you're making claims, but you don't have the monograph for it, then yeah, the FDA is going to come down on you like really strong. And I've been working with a company in the past where that's happened, and, you know, they send a warning letter and then they actually come to you and shut you down. So no, that's not true. And then also, like, if it's a bad product, the complaints itself, they're forced to, investigate that and force you to take down the product. So, I mean, they're a federal company. That's what they do. They're here to protect consumers.
Yeah, and like just to add on to that, a common claim that I hear, and this is like coming down to consumer confusion about the way regulations work, where the EU is very prescriptive that you have to do X, Y, and Z before the product is launched, where it's not spelled out as well or not as easily to people who don't have a background in the USA market. Perhaps that would be a good way to phrase it. But then these issues happen, and then there's like an expectation for substantiation. So people are like, oh, you don't have to do stability testing. Well, actually, you do, because if something happens and you can't substantiate the fact that you've done stability testing, then you're probably going to get into trouble. Would you agree with that or have anything to add?
I think with stability testing, I've been in situations where a lot of brands will ask the client, I mean us as the formulator, to do accelerated stability testing, or they'll have to sign a waiver with the manufacturer because they wanted to launch within a certain period of time, and they didn't want to do the 3 to 6 months stability, or at least 3 months stability testing. So they would have to sign a waiver with the manufacturer so that the manufacturer is not responsible. And I've seen that happen often. So and of course, these kind of products are products that are assumed to be safe because they're kind of like products that they had in the past, and they just kind of like reformulated them. But even when you reformulate and you use different suppliers, raw materials, you still may have an issue with the problem. And it's very important to do stability testing. And to go back to what I was saying before with these, the explosion of people, making products at home, this is a big issue because I have a lot of clients that come to me after a year of doing products at home. They don't even think about stability. And they're like, somebody said that I should be doing stability. I haven't had anything tested, no preservative testing and nothing. And these products are being sold by the boatload on the internet. So it's really not safe. And because I have a lot of people that come to me with these issues that are putting these products out, and other chemists that I know, they get requests for, chemists to actually, test their products and review them. I would be really wary about purchasing those type of products online.
And I guess that brings me to my next question. And I guess I have a comment from experience here. Just like one example, I sometimes help stores with like curating products to make sure that the labels are all compliant, because that's something I would maybe recommend to consumers. If this is something that you're concerned with, then like look at labeling laws, because an easy red flag, if the labeling is wrong, they're probably cutting corners elsewhere. So if they're not using INCI nomenclature on their ingredient list, they're just like walk away. Because they should, and that is the law. But then there was this one company that was selling a cake mascara that it was like going moldy on the shelf, and then the store that I was working with then connected the brand to me to review the formula. I'm not gonna say, obviously, I'm not gonna say any like who this is associated, what or where this was. But then I saw the formula, and she is measuring everything out in teaspoons, like not percentages. And then the preservative system, she doesn't know what's in the preservative system, and it changes like from batch to batch. She goes from like 2 different systems, and it was just like it was alarming that something like this would happen, and it was being sold on a store shelf. So there are obviously challenges, but they tend to be with these little mini brands. But I guess that's my segue into the next question, which is
Jennifer, can I say something?
Oh, yeah.
Can I say something? Here's the thing about when you mention labeling. Here's the thing that I've come across a lot with startup companies. They purchase the packaging before they even do packaging stability. And then second, their marketing people are labeling the ingredient listing completely wrong. This happens so very often with a lot of small brands. And you can tell if you go into a store and you read like, a container, you're like, wait a minute, this would never make a gel. This would make mush. Like it's like, or emulsion, like it would separate already because there's no emulsifier in it. And this happens so often, even when clients come to me to reverse engineer products. And I'm like, okay, no, I'm just gonna have to go by the texture to reverse engineer it because the ingredient label is completely wrong. And you're supposed to follow the FDA regulations, but they don't. And sometimes they, order like 50,000 bottles, and they're like, oh, well, no one's going to read it. No one's going to care. And that's a real big problem also that I've seen in the industry.
So now, with all this said, as you see it, where are the potential challenges with respect to safe products? Stephen, would you like to start this one?
Well, I would say, based on this conversation, right throughout the whole product life cycle, from ingredient selection to finally putting it on the shelf. I think this probably distinguishes the level of detail that we have to go through in the EU to assure the safety of finished products that are marketed in the EU, because there is a legal requirement for stability and microbiology testing to be done on a cosmetic that is going to be launched in this area, and it's incumbent on the safety assessor to actually check those parameters before they issue the safety assessment, the safety report for the finished product. So it can happen. You can have problems in manufacturing, potentially using incorrect ingredients or ingredients in the wrong percentages. You can potentially get contamination within a factory if your water supply is not adequate enough. So this is the whole premise of safety. Really is also built on good manufacturing practice. I can't remember, somebody mentioned it earlier on about we have to employ GMP standards to ensure that the product is actually manufactured and distributed in the correct way to assure consumer safety. You will get consumers misusing products, and we can't legislate about that. But we have to do as much as we can to assure the safety of the finished product, from ingredient selection, ingredient concentrations, through to the manufacturing, and then onto the launch. And I think so long as we are diligent in those areas, then the product should be safe, which is Anke alluded to at the very beginning, that consumers can do funny things with products, and unfortunately we can't legislate for that. All we can do is hope that they use them according to the instructions for use that we put on the packaging.
Anyone else want to chime in? Anke, maybe?
Sure. Well, one of the big risks that I see, apart from products that are not formulated by people who have the adequate technical background or who are collaborating with companies or formulators, who do all of the due diligence that Stephen just articulated. I believe that what we call the gray market is a big area for consumer risk, where dupe products or cheap or fakes simply are sold in outlets, where you cannot guarantee that the safety assessment has been done according to what it should have been. So I believe buying products in places where you wouldn't normally expect cosmetics to be sold, don't go buy cosmetics in a children's toy shop, or in very cheap online outlets. If you're buying a branded product at a price that is not in relation to what the product should cost, it's probably not the real deal. And then you cannot guarantee that product has been assessed to those standards that original company or brand would probably normally apply. I also wouldn't use secondhand products. This is something that I'm seeing growing online. And while I'm all for, minimizing the use of resources and the being very cautious of consumerism and the impact that we have on the environment, personal care is called personal care because you use it as an individual, and especially when we're talking about cosmetics that are used in sensitive areas like lips, eyes, anywhere on mucous membranes, sensitive areas of the body. I would very strongly advise for not sharing these products or selling them secondhand, because there's risk for microbial contamination, or you don't know how the person before you has stored these products. There's other ways to minimize consumption. Just don't buy 10 lipsticks, buy one. It's as easy. I could go on, but those would be my concerns for safety.
Cassandra, do you have anything to add?
Yeah, I agree with Anke. And what we mentioned earlier too, as far as concerns with safety, is how it's used, and different parts of the body which may be more sensitive for a product that's not made for that intent use. So I've seen, even in the salon, I've seen people use all types of even products that are not meant for the industry in their hair and the skin, and are so surprised when they have a bad reaction to it, or something really bad happens to their hair or skin, and they felt that, I thought it was okay to use it this much because I thought it would have a better effect on my hair or my skin, and or the area that is not really meant to be used on. And I think consumers need to do a better job at understanding how products are formulated and how they're labeled. If they're labeled for the eyes, they're labeled for the eyes for a reason, and for the skin body is for a reason. And the body product should not be used on the eyes, and the lip product should not be used on the cheeks or something, because there are ingredients in there that can be harmful, or you can have interactions or allergic reactions to that part of the body because you're using it improperly.
No, I just
wanted
wanted
to be too.
sorry.
So I don't think we should be too pessimistic. I think we need to be positive about the safety of, I would say, probably 95% of products on the market. So consumers shouldn't really be worried, in my view, of the product in the bottle. They should be mindful of the way that they use the product themselves. And Cassandra just gave some hints that people using other chemicals in applications which they shouldn't. Consumers should give thought to that as well, because they're not sold for those purposes, for cosmetic purpose, for a reason.
Yeah, don't use Sharpie as an eyeliner. I've seen that.
Yes.
Don't do it.
Or the Gorilla Glue spray on your hair. But I wanted to add to that also, Jen, about buying products like online, like I don't want to say which, but a very popular retail online store that sells makeup that everyone uses every day, and you can, I've bought makeup that, like Anke mentioned, that are dupes, that you don't know they're dupes, because there was a article probably a couple of years ago when I think Kylie came out with her lipsticks, and a lot of companies duped them from overseas, and they were selling them on this outlet. I don't know if I can say Amazon, but and they were not real. So, and then people had a lot of bad reactions to their lips. And that's a really big concern, because you don't know. And people think that if you're buying it on this outlet, this very popular outlet, that it's safe, and they're buying this product. And I'm not sure how that's regulated from that retailer, and how it gets into the country and how that happens, but that happens a lot.
We
Don't
lost
know, can't
Anke.
comment.
We lost Anke, but hopefully she'll come back. I bet block the room so she can come back. Now I had a quick question. It'll probably be a quick answer. Here she is. I'm just gonna readmit her and then probably relock the room after I ask this question. Okay, so this question was from one of my Patreon followers, Karina Marcuslin. Thank you so much for your support. In the EU, there's 26 allergens that need to be declared on the INCI list. Is this the same all around the world? And why are these specific 26 allergens that are chosen to be declared and not others? Just so you know, we covered this with respect to fragrance allergies in quite a lot of detail on the fragrance roundtable that I did with Pia Long and Angelo. What's his last name? Dermangelo, his Instagram name. So we cover this in a bit of detail. This is not a requirement in the USA, but perhaps, not a requirement everywhere. Do you guys want to chime in any further for that specific question?
I can try and give some background because I was involved for my sins from the outset when this legislation first came in 1999. It stems back to dermatologists' concerns that fragrance is one of the top three, probably, chemicals that causes allergic contact dermatitis. So people were publishing reports about certain chemicals allegedly causing allergic contact dermatitis. And at the time the original list was drawn up, it was split into two. Those that were termed as common sensitizers, and those that were termed less common sensitizers. When the legislation was finally published, the two lists were combined together to give a grand total of 26 substances. Now, these 26 can be found as subsidiaries in other aroma chemicals. So a good example is essential oils that can contain one or more of these 26. There are some synthetic chemicals represented as well. So the EU legislators decided that we would have to identify these 26 chemicals in a product's ingredient list if certain thresholds were exceeded. So in the case of leave-on products, it was 10 ppm, 10 parts per million. In the case of rinse-off products, it was 100 parts per million. Sorry, I tend to work in ppm and not percentages. The important thing to remember with those percentages is that it's the sum, and it also includes not only fragrances, but contributions from other cosmetic ingredients. And some people still today don't understand that. So over the years, we've had to label these 26 essentially as consumer information, although a lot of people use them as hazard signs as well now, to give people who are allergic to fragrance, who are knowingly allergic to fragrance, the opportunity to self-select products, so they can see whether these fragrance chemicals or in fragrance in inverted commas chemicals are present. So we've had that legislation around for quite a few years now. Some other countries that have adopted the EU regulation or the directive as it was originally mandate the labeling of these substances as well. We're shortly about to need to label a whole host more, somewhere between a further 60 and 70, to give somewhere between 80 and 100 or 80 and 90. It's still being debated within the EU, essentially to give consumers more information about those consumers who are allergic to fragrance. I've seen it read that so I've read it somewhere that people are encouraging the FDA to adopt the same type of legislation for the purposes of informing fragrance allergic people, where they've got where these substances are present. So it applies to fragrances and to flavors, because if you have a lot of flavor chemicals, for example, toothpaste flavor or a flavor that you might use in a lip salve or a lipstick, even though they're called fragrance chemicals, they apply to those substances as well. It's essentially a bolt-on to the ingredient labeling requirements, consumer information, and not hazard assessment.
Okay, so then my next question, back to my original questions, maybe I'll just ask Michelle, and if anyone has any further comments, then feel free to chime in. Are clean products, or those labeled as safe, actually safer than products that don't use these labels? What do you think?
I think it's obviously a no. Yeah, a lot of clean beauty brands are the ones who are avoiding the trendy ingredients to avoid, I'd say. So things like parabens, mineral oil, and so on. But I think a lot of the time, I find that brands that do talk about clean, a lot of their marketing is just so scientifically baseless that I sometimes wonder whether or not they're actually going through the proper processes for the rest of their products, apart from just being careful with the ingredients list. Yeah, I think a lot of the time they are avoiding particular preservatives, and they're using preservatives that are weaker, that are less effective. So I think, for example, we saw the recall of the Honest company's baby wipes that were going moldy. That was a company that was selling very much on the idea of clean. Yeah, I think that's pretty much what I have to say on that topic. If they can't get like the idea of safety correct, I'm not sure they have the idea of, stability testing and getting a good preservative system and that sort of thing correct.
Does anyone else want to chime in here before I ask my next question?
Well, the fundamental question, or the fundamental premise in the EU, is that a cosmetic has to be safe. So two cosmetics side by side, technically, they are safe. But within that, there are certain responsibilities that people have to follow. Michelle's just alluded to inadequate preservative levels. That's part of the safety assessment to ensure that the product is, as a whole, is safe for consumers to use and not going to impact on their health and well-being.
So the next question is around Cosmetic Vigilance. Why is this important? And also, what is it? Stephen and Anke, I feel like you guys are really passionate about this topic. So maybe you guys can chime in on this question. Stephen, would you like to go first?
Well, yeah, a particular interest of mine. Well, Cosmetic Vigilance has come to the fore probably in the past 10 or more years, or the emphasis on the importance of it. And essentially, it's a process where we as a speaking with a cosmetic brand hat on, although I don't have one, we track the performance of our products in the market to ensure that they are not causing any, the official term in the EU is undesirable effects in consumers. I think it's a very underrated process. People don't, in my view, fully appreciate the power of that particular science, and it allows us to first of all identify products that may be causing problems, and then hopefully cause some remedial action, review of formulations so that we can address what's happening, so we stop it happening in the future. And again, the EU regulation is very strict in terms of it requires companies to conduct a cosmetic vigilance process and actually record the results, the outcome of that process in their safety assessment, in what's called the Cosmetic Product Safety Report, and also in the product information file. There is a separate category of undesirable effects called the serious undesirable effects, which are those that have to be reported centrally back to a central governmental, or in the EU, a central EU organization. Serious ones are those that are defined as, according to the WHO guidelines, similar to a pharmacovigilance process. So things like people having to take time off work due to the reaction, any changes in congenital changes. So if you get babies being born with congenital problems, or ultimately death. Now, hopefully, the last two shouldn't really happen with cosmetic products. So it's those that cause risk, serious risk to the consumer, and it's been used extensively more and more throughout the world. In fact, in China, in the most recent version of their cosmetic regulation, there's now a requirement. There will be a requirement to undertake cosmetic vigilance, acknowledging that it's an important part of cosmetic safety. So we can do all manner of paper reviews, which is what we do in terms of assess the hazard and the risk of the product, but it's not until it's launched that you actually get to know how it will behave. And cosmetic vigilance and market surveillance will also help you identify products that are being misused, and you can then take steps to mitigate that. You can put words on the label to tell people not to use it, or to make it clear how people should use it. So for me, it's a very, very powerful aspect of a cosmetic product life cycle.
Now, maybe I'll ask this chat question that came in from Annika to Anke now, with that in mind. Would you say marketing goes under cosmetic vigilance? Maybe relevant to Michelle here, as online scientists are quite often told to shut up about marketing as if we don't understand it. Michelle, perhaps your perspective or your experience over the last few months. Anke, what do you think about that?
Well, the first part of the question was if cosmetic vigilance is part of marketing.
Marketing goes under that, yeah.
So cosmetic vigilance is what we would consider coming post-marketing. So once the product is on the market, and then there is a monitoring program at any given cosmetics company that basically lists and takes records of any complaints coming in, and then that is being monitored, and changes to the product can then be made accordingly. So if something turns out that a lot of people are having reactions to, maybe there is a reformulation adequate, or if it turns out people are using the product in a certain way that it's not supposed to be used, and then the usage instructions on the packaging have to be changed. And that falls partly within marketing, because that's communication with the consumer or to the consumer. In regards to if scientists should be talking about marketing, I think that scientists should be probably talking a lot more to marketing, and also be involved more in the actual marketing, talking to consumers, because this is where a lot of the misunderstandings happen. A lot of the facts become slightly altered by linguistic aspects and by language adaptations in the marketing, and this is something that translates directly into myth formation and misunderstanding on the consumer side. And I am going to leave the stage for Michelle to extensively comment on this, but my personal opinion is that we would probably be in a lot less of a pickle as we are now in respect to myths, misunderstandings, people being afraid of certain chemicals or chemophobia spreading, if we had more scientists consumer facing and being more involved in the marketing. And I'll leave the stage to Michelle.
Yeah, I completely agree with you, Anke. We definitely need to have more scientists checking over the marketing before and after the marketing people have written it up, because apart from just the safe, you need a bit of a science background to work out what you can and can't claim, especially in terms of ingredients, understanding in vitro versus in vivo information, like whether or not you can say that if, let's say, there's a cosmetic ingredient that at 5% gave a particular effect in rats, what you can actually say on the packaging of the product, or if they did a clinical trial, if that clinical trial was actually good enough for you to put a claim on the product, if your product is similar enough to the product that they used in the clinical trial. I think, a lot of the way that it works is, it seems like there's a lot of dodgy claims on packaging, even from really, really large brands. I think we've all seen brands make drug claims that shouldn't be allowed. We've seen brands make the claim and then try to back it up with particular evidence that doesn't actually support their claim. There's clearly, even in very, very large companies, there are massive gaps between what the science says and what the companies are claiming. And I'm including, there are brands that are part of large multinational conglomerates that are making these very, to me, as someone who isn't, a regulator, I can see that it's an error and it's something that they shouldn't be claiming. And the fact that, I can see it, I'm sure Annika can see it as well. She has messaged me quite a lot with these sorts of things. I think the fact that consumers like us can see it is a big problem. There's clearly something going on within the organization of these companies where there isn't a scientist checking it at a particular stage. And it's quite concerning. And it's just misleading to consumers as well. Another aspect is even like outside of the actual product itself, it's just the marketing around the product. So in Instagram posts, on the website, in magazines, when perhaps a representative from the brand is making claims about the product, I think all of this just doesn't get checked as much as it should. And it's a massive problem. And I know in some countries, you can report these sorts of things to an advertising standards board of some sort. And then some countries take a much stricter stance on this, and they'll actually, send out warning letters and give out fines, but a lot of countries don't. And I think if you want a marketplace where there are products that are safe and effective, then I think marketing is definitely a place where the regulation could be improved a lot.
I had another comment from E.C. Sanchez, and along the lines of, Michelle, something you and I have been talking about based off of some of our previous experience, that perhaps this could be an opportunity for science communication, more science communication in the field. Perhaps important, scientists getting out there and communicating in a clear way. And like, scientists aren't maybe I'll just clarify that scientists aren't always the best at communicating to consumers, and perhaps this is part of the reason why we're where we are right now. And perhaps people that are really good good communicators can do a better job connecting to the consumers to like improve science literacy, improve knowledge about the space, because otherwise there's so much misinformation. And like, I just want to say this. Michelle and I recently were bullied by an older cosmetic scientist on Instagram for doing science communication, and he felt that we're just reporters. We have no background, so we shouldn't be doing this. Why are we talking about it? It should be him. He's so much more experienced than us. He should be the person communicating. And I just want to, like, if you're a scientist in the industry and you think this, I would question that thought process. I just want to say that before I ask my next question. And I'll put myself in the speaker view. I keep getting texts from James downstairs that I need to go into speaker view for you guys while I'm talking. Sorry. Off my soapbox here, and I'm sure this will be a conversation for future discussion on our podcast. Michelle, maybe you could be a part of this. Sorry.
Jennifer,
Yeah.
can I further comment on what Michelle
definitely
was just speaking on, as far as like the chemist being part of the marketing group? When I worked with manufacturers, actually not work with them, but when I worked for them, I was definitely excluded from that part. When consulting with them, that's a whole different story. Then they would listen. But when I worked for them, the brand identity team already had the whole marketing story. They hire copywriters to make up this compelling story to sell the product. So the marketing team is, in their mind, is you're just making another lotion or something. It's not really that great, because the actives were actually a percentage of 0.0001. And it's just like, okay, they're making a big story about this active that's like barely in the product. And you're like, wow, that's a product I just made. It's not even that serious. It's just a lotion, And so a lot of times they get information from the internet as well. So, well, not a lot of times, they just get the information from the internet. They don't get it from the scientists. And, I've been working on a brand and with a team of brand marketing people for a product that we're working on together. And, they came to me about like some of the ingredients I was using in the formula, like as far as preservatives and surfactants. They're like, oh no, we can't use, sodium lauryl sulfate. And I was just like, yes, I can, because this is how we're going to market it. So you need to go do some research, and here's some information about this preservative that I'm using and that, because they were coming to me as if like they knew everything and I knew nothing. And I had to sit them down and say, no, it's not going to work like that. You are not the scientist. We know more than you. And we're going to tell you what is important in this product and why what you're reading off the internet is not correct.
Okay, so this
I've
is
actually
heard,
sorry. I've actually heard stories of that happening in, again, brands that are under a large multinational conglomerate, where the marketing person is like reading and trying to get through studies and going through peer-reviewed articles, and somehow out of that they've come out with this particular ingredient needs to be avoided, which is completely not the case. And these are large multinational companies that have giant teams of scientists, and then they still have a marketing person who's creating the whole product brief, and then they've already got the whole marketing story behind it. And that's just a massive systemic problem, I think, in the industry.
Yeah.
Well, if I may chime in, I've experienced two very different scenarios. One very much the one that we've already outlined. And then another one where there was actually once a week, and this was a global brand at that time, also part of a big multinational. Every Friday, there was a copy review meeting. And throughout the week, all of marketing had to submit all of the material, packaging, labels, online copy, anything going into print, anything going into, billboard advertising. It all had to be submitted by a certain deadline. And then a group of formulation, claim substantiation, and regulatory would sit together on Friday and literally go through up to 300 pages of text and do the claims review and just say, you can say that, you can't say that, you can't say that, which I thought was great. This is how it should be. Now, that doesn't mean that all of the review also made it into reality, because what happens quite a lot is in the end that the business then makes a risk assessment and decides what are the things that we could still potentially get away with. So I think from a process point of view, there are definitely some companies that are implementing, you know, at least parts of the process where R&D is gaining a seat at the table. But then, unfortunately, the business either takes an overriding decision, or the input from the technical side is not always taken fully into account for whatever reason. So going back in circles, I think it is happening in some companies, but there needs to be a better relationship and more reliance and more taking into account what the scientists are saying.
Okay, so we're already over time. Hopefully you guys are okay with just answering one more question to wrap this conversation up. Obviously, this is a conversation. I feel like we could chat for days, not just hours, days. There's so much to unpack, like even like with these like individual questions. There's so much to it. My final question to each of you guys is, based off of what we've been talking about, do you have any suggestions? You can direct this to whoever or everyone from this question. So any suggestions for consumers, brands, and the industry as a whole? Cassandra, would you like to start this one?
Yes. I would have to say that, you know, the products in the US are they're generally safe. Just be careful on where you're purchasing the product. And you know, the startup brands, I'm not going to say like the startup, the indie brands are not bad products, or they make really, really good products and they have really good formulators, some of them. And I'm just a little wary at the beginning stage of the behind the scene. As Anke mentioned earlier, you know, you can always, you know, say, hey, the formulator, you know, put in their input as far as like the science background for the formulation. And then the marketing person's like, okay, we're going to make this copy about, you know, this type of claim or whatever, or no claim. And then, you know, the people that are higher up are cutting it down to like, no, we need to sell products, so it needs to say X, Y, and Z. Because the industry is saying that this is not safe, or this is, you know, safe. So I would say if you really care about the products that you're putting on your body, to, you know, look to the people who are experts in this field and seek their knowledge and their understanding on what's going on currently in the market.
Anke, what do you think?
Sorry.
Stephen, you could go next.
Yeah, I would agree with everything Cassandra said. We shouldn't be too pessimistic, as I mentioned earlier. And I think it's okay to have a bit of healthy skepticism, but be careful about where you get that information from. If it's, for example, somebody telling you that substance X is bad, and you find that they are behind a brand that doesn't use substance X, you know, be a bit more skeptical about what you see. Do a little bit more research if you are concerned. But I think you can be reassured that certainly in Europe, the UK, Canada, and the US, can't speak for Australia because I don't really know much about that market, but the bigger brands, certainly you can use the products safe in the knowledge that they've been reviewed for their safety, and you shouldn't come to any harm as long as you use them within the constraints that they tell you how to use them.
Anke, what do you think?
So I'm going to keep this really short with some advice for consumers, for brands, and also for fellow scientists. For consumers, I would say use the products the way they're supposed to be used. read on the label how you're using the product and don't use it any other way. And also get rid of those reviewing products for safety apps. Open the app that you're using, and if it doesn't give you any information about concentration, it's useless. So if it's a hazard-based app, get rid of it. It's not doing any good. For cosmetics brands, I would say invest in your R&D team or in your marketing team if you have to, for a position for a dedicated scientist to be involved in your marketing. Consumers are looking for information, and you are responsible for informing your consumer adequately, and in that sense also responsible for shaping our market and for making sure that we are not limiting ourselves, which is what's happening currently in respect to true innovation. So my advice to brands would be get some scientists onto the forefront. And if you don't have one in your team that you feel confident in talking to consumers, hire one. And for other scientists, I would say, if you feel strongly about talking to consumers, get on social media, start Instagram accounts, start engaging on YouTube. If you feel that you have the authority to message and to be in touch with consumers, get out there. Where are you? We need you. These conversations are important. They need to happen so that consumers can make informed, truly informed decisions and not only get driven by commercial interests of uninformed or intentionally misinforming marketing teams.
And finally, Michelle.
I'm not sure I have very much to add. I agree with everyone's points here. I guess the only extra things are, like, for consumers, honestly, if you're watching this, you are probably one of the most dedicated ones, and it's basically preaching to the choir. But I guess maybe it's just, Jen and I and everyone else on social media, we're very tired. So if you do know the answers, like, feel free to jump into the comments and spread the stuff that you know. Like, given that you are probably, the top, I don't know, fraction of a percentage of informed consumers, since you've just sat through a hour and a half panel on this. For brands, I think, science is currently the trend. So it would be nice to be spreading the correct science. And I think for scientists, if you do want to go on social media, of course, start your own account and spread that, but also, maybe contact me if you want to do a collaboration, if you want us to help you. Maybe you're not very confident with how to approach social media. Maybe you want to utilize our larger platforms. Contact us. And if you have a good idea, and I personally love collaborations. I'm sure obviously Jen collaborates all the time. But yeah, you use science communicators.
Here. I also want to highlight this because I have a few scientists in my network, regulators and toxicologists. Stephen is one of them, Anke as well, that I'll just reach out to continuously when I have questions. And if you are a relevant expert willing to, especially like I don't want to put out inaccurate information, obviously, and I want people to help. And if you don't feel confident communicating and you would like to still be a part of this, then reach out. Maybe you could still help out with the science communication that's happening online. And thank you to everyone who has been helping me out. It's been super helpful. Well, that concludes our panel for today. Thank you for sitting. We've gone over time today, but this was such an interesting, informative conversation. I hope more people watch it. If you're watching this and you really enjoyed it, share it, or maybe share some of the take-homes on social media that you've learned. That would be really helpful for spreading the information that we've just shared with you. I'm going to be taking a break because since at the start of the pandemic, I was like, oh, I'm going to do this once a month until the pandemic ends. Actually, it might have been twice a month initially. And then it just continued. So for like the past year and a half, I've been doing these once a month. Well, it looks like maybe there's an end in sight, but it's been going on for like a while. So I'm going to take a break from these panels, and I will be back in September with a future panel. If you have any topic suggestions that you'd like to see, then leave it in the comments and I will take it up for consideration. I'm always looking for more topics to cover, if not in a panel, in a podcast suggestion. We're also going to be taking a break with our podcast. If you're unfamiliar, I do have a cosmetic science podcast, and I post conversations every week with relevant scientists. But I will be taking a break probably in June, but again, I'll be back in September. And in the interim, if you're looking for more conversations like this, I also have a Discord page where we do like weekly conversations, our cosmetic chemist dish. I'm trying to do more live podcast recording. So if you'd like to join in these conversations live with actual relevant scientists, then join us over on Discord. I guess I'll leave the link in the description of this conversation. It's also on my Instagram. But that concludes our conversation. Again, if you missed any of it, it's going to be published on our YouTube channel immediately after this conversation. But big thank you to our panelists for donating your expertise for this conversation, and to all the audience who joined in live to ask your questions. I hope you all have a great rest of your day.
Thank you. No, thank you for involving me.
Thank you. Bye-bye.